I'm seeing more and more clients every day asking about hair loss treatments, and it makes sense. Hair loss affects confidence just as much as anything else we treat here at Glow and Sparkle. A lot of people don't know what options are out there besides medications or hair transplants. So let me tell you about one of the most popular treatments that is getting a lot of interest right now, and that is PRP, or platelet-rich plasma for hair restoration. And here's how it works. We draw a small amount of blood, just like you're getting a regular blood test. And then we take that blood and then we spin it in a centrifuge to concentrate those platelets, which are packed with tons and tons of growth factors. And then we inject that concentrated plasma into your scalp, specifically in areas that might have that hair thinning. Growth factors then stimulate dormant hair follicles and encourage them to start producing hair again. It's not an overnight miracle. You're not going to wake up to this full head of hair, but over a few months, you will start seeing thicker hair, new growth of hair in the areas that did have thinning hair in those certain areas. Now, here is the important part. This works best for early to moderate hair thinning or hair loss. If you are completely bald in an area or a patch area that does not have any hair follicles left, then unfortunately there are no follicles to help stimulate with the PRP. But if you are noticing thinning, maybe a receding hairline or patchy areas, this can make a real difference. It's your own body's growth factors, so there are no side effects like you get with medication. And it is way less invasive and way less expensive than if you were to get a hair transplant. We usually recommend a series of treatments spaced out over a couple months, and then maintenance sessions is needed to keep your results. So if you are dealing with hair loss and you're not really sure what to do about it, this is worth considering. The earlier you start, the better results, because you're working with the follicles that you still have. This is Fatia Johnson, the nurse practitioner over at Glow and Sparkle Aesthetics and Medical Spa. Reach out to us today if you have any hair thinning that you have noticed to see if you are a great candidate for PRP today.